Hello everyone, I'm Dr. Chen. In today's tutorial, we'll go over how to position and scan the infraspinatus. When scanning the infraspinatus tendon, ask the patient to place their hand on the opposite shoulder for support. This position stretches the infraspinatus muscle, making it easier to observe. There are two ways to perform the scan. One way is to scan horizontally along the inferior edge of the scapular spine toward the humeral head. Use a linear probe and set the depth to around 3 to 5 centimeters. At this point, the curved structure in the center of the screen is the humeral head. The thin layer on top is the articular cartilage. Above that, the brighter structure is the infraspinatus muscle tendon. If you want to observe more of the proximal region, move the probe further proximally. At the bottom of the screen, you'll see the junction between the humeral head and the scapula. This marks the location of the posterior labrum. If the patient is suspected of having joint pathology, we can use this area for observation. Of course, if the patient has a dislocated shoulder, specifically anterior dislocation, you may observe displacement between the humeral head and scapula alignment. During posterior shoulder scanning, not only you can visualize the infraspinatus tendon, but also assess for joint dislocation and evaluate the glenoid cavity. I hope this is helpful to your practice. That's all for today's tutorial. I will see you in the upcoming videos.